The most common disorder of the spine is degeneration of spine, which in general term will mean wear and tear of spine or aging of the spine. That leads to compression of the nerves, which is causing pain in the form of backache or neck ache, which is relating to your arm or relating to your leg, depending upon the where the compression is. The other disorders of the spine are like spinal trauma. They could be spinal tumors, there would be spinal infections like tuberculosis, metabolic disorders of the spine, and then listhesis of the spine, which means slipping of one part of the spine over the other, which leads to pain in the spine. Coming to the diagnosis of these things, basically the patients will be driven by pain only, and they will come to me only when they have a pain. So depending upon again the amount of pain they have. So once we have taken the history of the patient and then accordingly applied the neurology and examined the patient, so we are able to pinpoint or maybe focus to a area where the possibly the problem is, and then the investigations are done in the form of CT or MRI of the spine, the part of the spine which is required, and accordingly depending upon the report and depending upon what we see in MRI and the symptoms, once the two match, once the symptom and what we see in MRI they are matching, then you automatically come to the point that possibly this is the reason for the problem, this is the reason for the pain, and that is then accordingly depending upon the thing, it may require medical management or it may require surgical management, and that is done accordingly.